Video on cognitive bias and its types. This video is a part of our series on epidemiology and biostats. My name is Dr. Wahab Fazal and let us get into it. So first of all, what is cognitive bias? Cognitive bias is when the beliefs, as basically the beliefs or the thoughts or whatever is happening inside the head of participant or researcher gets into the study itself. How is that possible? Basically, it changes their responses leading to different results. Let's look at it. So cognitive bias is divided into two types. The first thing that we're going to talk about is response bias and then Pygmalion effect. First, let's focus on response bias. What is response bias? I talked about non-response bias in my previous video. Let's understand response bias with the help of a simple example. So you want to measure the average fast food consumption among doctors. Most doctors report very low fast food consumptions. Well, you go to the hospital cafe and you check their hospital bills and how much they have eaten in the last few days. The cafe bills in the hospitals differ. Most doctors, in fact, have ordered a large amount of fast foods. As you all know, doctors are habitual of eating this stuff because we don't have time and we want to eat food, good food basically. So what is happening? Well, the doctors know that fast food is bad for their health. So they know that this is the socially acceptable response from the doctor. And they are giving the socially acceptable response of eating less fast food. But in fact, they're eating a lot more fast food. That is fast food. That is, in fact, response bias. When you give the socially acceptable response due to some thought or perception in your head of that thing. That is response bias. So what is response bias? The definition is false response by the participants to give socially acceptable answers. You ask a doctor if they have a lot of coffee and they'll say, no, maybe, I don't know. Because it's not socially acceptable to say, I have a lot of coffee. What if, but they actually do. They're giving a false answer. They're giving a socially acceptable answer. You ask them if they exercise or not. Most of them don't. I know it personally, but they'll tell you, I try to work out, but they don't. That is the socially acceptable answer. It's a false response. This is also sometimes known as misinformation bias because the participant is answering or his response to the questions is wrong. They're giving false information to giving the socially acceptable answers. Let's try to understand this with the help of another example. A study is done to assess the physical and emotional abuse in a prison. None of the prisoners came forward to accept there is any sort of physical or emotional abuse in the prison. The study fails to get any legitimate responses. Why is that? Why? Because if you know, in a prison, snitches get stitches. If you do the same study anonymously, the results are much more objective and a lot of people come forward now because they know it's anonymous. So the thoughts and the perceptions and the ideas of the participant, for some reason, if they give false answer, that is false response or response bias, also called misinformation bias. So if you look at our cognitive bias chart, we talked about response bias and now we'll talk about Pygmalion effect. This is a very interesting name, but in fact it's a very simple. So I told you that the beliefs of the participants or the researcher gets in the way. Well, we talked about the participant, now we'll talk about the researcher, Pygmalion. So what is Pygmalion effect? We'll remember Pygmalion effect with the help of a simple example. A new teacher is told that Joe and Steve are the gifted students of her class. She spends a lot more time and effort with Joe and Steve working on their math skills than the rest of the class. What has happened? You told the teacher that these are the two smart kids of the class. She now spends a lot of time with those two smart and gifted kids on their math skills because she was told these two students are very good. What will happen? Because she spent a lot more time and they're also smart, they get great marks. This is Pygmalion effect. When the researcher or the person who is doing the study, their ideas, their beliefs, their perception somehow muddle the results of the study itself. So if you look at the definition, and we'll take another example as well, more research focused example. Expectations of the researcher change the study results. This is also called observer expectancy bias. Basically, the observer is now expecting something specific from the participants. You're expecting something, you're expecting a specific answer. It's like asking a patient, are you okay? And the patient says, yes, I'm okay. But are you actually okay? because you're suspecting that something might be going wrong, and you ask the patient, but are you actually going okay? But do you really not feel sad anytime? Do you feel the urge to cry right now? And the patient is like, no, I don't feel. And then you keep asking, but have you lost your interest in things? And somehow the patient is like, maybe I've lost my interest in things. Maybe I also feel a little bit sad. That's how you change the study results, due to your own thoughts and perceptions that there might in fact be something wrong going on with this patient. This is observer expectancy. You were expecting a certain response, and maybe even something going on in the back of your mind changed the study results. We'll take another example that will make this even more clear. You want to study the link between increased sugar use and obesity. So what do? You go to obese patients asking about their sugar usage in a research questionnaire. What do? But you must have had some sugar. But you must eat a lot of sugar. I think, no. Do you really think you don't eat that much sugar? And then most patients agree on high usage. There might even be hereditary aspect of their obesity in their family, but you didn't care to ask about that. You were focused like this on their sugar usage. You were expecting the answer of yes from the questionnaire. That's why you kept repeating on that effect. So Pygmalion effect is also called a self-fulfilling prophecy. Basically, your thoughts and perception in your head change the entire study results because it's a self-fulfilling prophecy. You tell someone these are the smart kids, they only focus on the smart kids and they change the results of the study. So it's very important when you're doing the study to have your expectations of the results not change the entire study itself. That is observer expectancy effect, Pygmalion effect. The Pygmalion name is quite interesting. And then when you think of this effect of self-fulfilling prophecy, that if you have this going on in your patient, this population is very depressed, and you keep asking that population again and again whether you're depressed or not, and you get that answer out somehow, which happens a lot in our clinic if you think about it. But you must have this kind of pain. You must have this kind of pain. You change the result of your patient. You do Pygmalion effect. You do observer expectancy bias. It's very common. It's a self-fulfilling prophecy. So what's the takeaway from this lecture? It's a very brief lecture. Cognitive bias are when the belief of the participants, that's response bias, or researchers, that's Pygmalion effect, that's us, that's doctors, that's healthcare providers, when you change the results of the study depending on your thoughts and perception. Response bias, false answer by the participants. Pygmalion effect, researcher expects a certain thing that causes a change in the results. Observer expectancy bias. In the end, thank you so much for watching this video, and dream big, start small. If you like this video, then be sure to subscribe to my channel and press that bell icon.